Back to Pretoria to the media briefing by Public Protector Busisiwe Mkhwebane as she's addressing the media about the various reports that have been released by her office.
Johannesburg procurement irregularities report. Over to you, Deputy Public Protector.
Thank you, Program Director, the Public Protector of the Republic of South Africa, the Acting Chief of Staff of the Office of the Public Protector, the Acting Chief Executive Officer, Ms. Mkhwebane, the Chief Operations Officer, Mr. Laki Mohalaba, members of Executive Management of Public Protector South Africa, members of staff of Public Protector South Africa, members of the media, ladies and gentlemen, I greet you all. As the Public Protector has outlined, I'm going to take you through the factual report on inspections that were done by the Public Protector and I through the public health facilities within the country. We embarked on a nationwide tour of about 5 provinces to carry out inspections at various public hospitals where we assessed those facilities' state of readiness to cope with the pressures brought about by the COVID-19 pandemic. This was after the President of the Republic of South Africa, President Cyril Ramaphosa, on the 23rd of March 2020, announced a 21-day national lockdown as part of measures aimed at containing the rapid spread of the COVID-19. The lockdown still continues to this day, albeit with less restriction than was the case in April 2020. The provinces which we had embarked our inspections in were Gauteng, Mpumalanga, Eastern Cape, KwaZulu-Natal, and Limpopo. As we had indicated on various occasions during the inspections, we have now prepared a factual report on our observations. This report has been submitted to the Minister of Health, the Presidency, the Minister of Finance, the Premiers of the respective provinces, as well as the MECs. And the purpose of the report is as follows: to inform the Minister of Health, Dr. Zwelini Lawrence Mkhize, about the challenges relating to healthcare facilities received during our inspections across the 5 provinces. Apologies, I've been asked to remove the mask because clearly I'm not as audible as required. Further, to identify common cause issues at the various hospitals and to request implementation plans with clear and definite timelines from the affected authorities where concessions on inadequate service delivery have been made, and in cases where interventions are already underway. The report covers accountability and undertakings for inadequate service delivery. We took this approach with the view of establishing factors behind the flood of complaints or potential flood of complaints received or to be received by this office. The inspections focused on factors or gaps behind all the problems or complaints reported in some of the 5 provinces, some of which were captured by the media houses in the country. In all, we inspected 17 public facilities across all these provinces, and the breakdown thereof is as follows in no particular order. The first was Gauteng. We inspected the Jubilee Hospital, Dr. George Mkhari Academic Hospital, Steve Biko Academic Hospital, Lillian Ngoyi Hospital, Chris Hani Baragwanath Academic Hospital, Charlotte Maxeke Johannesburg Academic Hospital. In Mpumalanga, we went to Temba Hospital. In the Eastern Cape, we went to Sulenkama, known as Messinites Hospital. Umtata General Hospital, Livingston Tertiary Hospital, Uitenhage Hospital. In KwaZulu-Natal, we went to Christ the King Hospital, Richflay Hospital, Mbongolwane Hospital, St. Mary's Kwamakwaza Hospital. And finally, in Limpopo, we went to the Limpopo Capricorn District Hospital as well as to WF Noble Hospital. In the interest of time, I will not go through our observation in respect of each and every one of the 17 healthcare facilities. Instead, I shall focus on common issues identified across all the facilities. In doing so, I will traverse the following thematic areas: PPEs, capacity of vacancies, unions, psychiatry wards, linen or laundry, response times of ambulances, state of facilities and building space, cleanliness of hospitals and lack of equipment. Starting with the personal protection equipment, there was insufficient procurement, distribution and provisioning of personal protection equipment to ensure that the staff and the COVID-19 patients were adequately protected from the surge of the pandemic. It was a cause of concern that the PPEs were collected at the warehouse and they were procured by the department and not the hospitals themselves according to their personal needs. There were no dedicated drivers appointed to collect the PPEs at the warehouse, and as such, this contributed to the delay in receiving of stock. Hospitals did not have sufficient PPE. Centralization of procurement in general is a huge challenge for these hospitals. At some hospitals, staff are required to use one PPE for the entire day, even if they have to go out on lunch and back into duty again. Some wards were not provided with appropriate PPEs. Only doctors were provided with full PPEs and not all medical staff in some instances. Some were required to reuse the masks. An incorrect PPE mask were procured, such as the usage of the N95 PPEs vis-a-vis the KN95. There were incorrect sizes ordered. Inadequate protection of healthcare workers and other staff members due to lack of PPE. Nurses only allowed one bodysuit per day. Incorrect sizes of these suits, which resulted in immediate tearing in some instances. Nurses were forced to wear bodysuits even if it is torn, thereby risking their health. The procured PPEs were not as per specifications. They were also reported to be substandard. PPE stock levels at the warehouse where PPEs were collected were very low and ran out at some stage. Non-delivery of the procured PPEs by the appointed service provider who was on the provincial database. At some point, there were substandard PPEs that were delivered to the hospitals as the gowns were unsterilized and they did not fit the staff complement. Availability of required sizes for some of the PPEs was a challenge, such as boots and goggles. There is shortage of thermometers, shortage of disposable bins, decanters, oxygen points, and the PPEs in general were a huge shortage. Some hospitals were assisted by NGOs which provided PPEs. Capacity of vacancy rate. The lack of staff capacity affected the smooth running of hospitals. Even under the normal course of duties, and this became worse under the COVID-19 pandemic. Posts were not being filled, which has an adverse effect on service delivery. Shortage of staff or insufficient capacity to deal with elective surgeries, clinical, nursing and support services. Delays in the filling of specialized positions, those are the clinical positions, in the hospitals due to the centralization of procurement to provincial level. Non-clinical posts not being filled, resulting in health professionals assisting with clerical and porting duties. Chronic nursing staff shortage and lack of professional nurses to staff the areas optimally. Workload for the doctors was too high and they were often expected to work excessive hours as a result of the shortage of clinical staff. And the labor unions, the lack of communication between management and staff, high infection rate of employees, poor relations between management and labor, and lack of cooperation between labor and management. Looking into the psychiatry wards, it is a very serious concern that psychiatry is not as adequately provided for as it should be. In some hospitals, patients are left to lay in casualty where other patients are being received and has resulted into attacks of other patients and even of staff. In other hospitals, they are caged within the normal wards. Lack of sufficient resource to deal with psychiatry, even the professional staff unable to deal with this specialization, as it takes outside of the normal 72 hours to transfer these patients to the specialized hospitals. In most of these hospitals, it takes up to 2 to 3 months to have these patients transported to psychiatry hospitals, meaning that they remain at these hospitals without being adequately treated and attended to, thus posing a huge risk to themselves, to general members of the public, and also to the hospital staff. In the area of linen and laundry, there are delays regarding the turnaround time in the washing of the linen at hospitals. Staff washing the linen at the laundry of COVID-19 patients don't have the appropriate equipment to protect themselves. Poor maintenance of laundry machines lead to breaking regularly and have challenges in respect of maintenance in this regard. Shortage of linen has serious impact on operations of hospitals. Patients being treated on beds with no linen. Non-functional laundry equipment such as washing machine, dryer and irons. Insufficient supply of clean linen. Patients have to use their own bedding because of the shortage of linen in hospitals. Response times for ambulances. There's a huge challenge regarding the response times of ambulances. Hospitals do not have sufficient ambulances, especially in the rural areas. Ambulances are not serviced, nor are they cleaned nor sanitized. The state of facilities and building space at the healthcare facilities. There is no compliance with building safety standards for hospitals. Safety doors and lighting detectors are not working. Files of patients' records are on the floor. There's an evident lack of filing room space for storage of files. Archiving has been found to be a serious challenge, which has also been reported to result in some of the litigation that happens against the Department of Health, because most of these records would not be found. Lack of a proper IT infrastructure. Hospitals have infrastructure challenges in respect to space. Infrastructure is old, as some hospitals were built from the 1930s with no proper upgrades. Old hospitals with aging infrastructure. Some dilapidating. Infrastructure problems with buildings such as leaking of roofs, broken toilets. Some male and female patients are forced to share the same toilets. Cracking of walls. General lack of maintenance of the buildings. Lack of network connections for virtual services. The population is increased in certain areas with no proportional increase in hospital space and general service delivery. Shortage of intensive care units. Insufficient consultation rooms. Some doctors are forced to consult in the same room, share the space, and this results in the compromise of privacy of the patients. Cleanliness of hospitals. Medical waste laying on the corridors in hospitals. Lack of proper process for securing medical waste boxes. Lack of linings and delays in the collection and disposal of medical waste by the service providers. Lack of equipment, poor ventilation in hospitals, lack of equipment such as piped oxygen, old cylinder gas oxygen being used which has no spares, insufficient oxygen points, general blood pressure and x-ray machines are not enough, susceptible to regular breakdown due to lack of maintenance and being irreparable. Laundry machines are old and irreparable. Shortage of medical equipment such as ultrasound, baby warmers, BP machines, CPAP, suction machines, mobile x-rays, Dynamap and ECG machines. Old and insufficient motor vehicles. For instance, at Umtata General Hospital, when we got there, they didn't have any motor vehicle, as all their motor vehicles were seized by the sheriff. Thus, they could not execute their duties as required. Delays in the maintenance in provincial level of the MRI, radiology, oxygen machines due to lack of contracts with service providers, as these are all centralized to provincial level. Old and outdated x-ray machines. Delays in procurement and servicing of geysers, heaters, telephones and printers. Delays by the Department of Infrastructure to service, repair taps and repair the laundry machine. There's a lack of cooperation between the Department of Infrastructure and the Department of Health, as they are interdependent when it comes to the maintenance and services to the hospital. There's a host of interventions that we propose in respect of each of the facilities to deal with the various issues identified. They are for both the short, medium and long term. I shall at this stage not go into detail of each and every. Suffice to say, they seek to remedy the challenges that we have identified. For instance, we propose that at Jubilee Hospital, the department must in the short term ensure that it capacitates the hospital with respect to conducting its own COVID-19 tests. The procurement of COVID-19 test kits will assist in alleviating the turnaround time for the test, especially in light of a possible second wave which we are in. To ensure that sufficient and adequate PPEs are received by hospitals upon collection from the depots. The PPEs must be in line with the requested specifications, and the department must immediately train all staff in relation to the risk strategy and the work of the risk management committee, which we have found is not operational in most of these hospitals. In the medium to long term, the department must ensure that the hospitals have a business continuity management plan regarding the manner in which elective surgery is phased in post-COVID-19, and ensure that there is sufficient ambulances to cater for the needs of the masses who must access health care. In the case of Dr. George Mukhari Academic Hospital, we propose interventions that have to do with risk management and business continuity. The full details of the interventions per facility can be found in our full report, which will be accessible on our website by this afternoon. But to mention, before I complete, at Lillian Ngoyi Hospital, where mothers lay there after giving birth without proper nutritious food, without heaters, without geysers to wash themselves and their babies. This needs to be addressed urgently. As a way forward, the oversight role of the minister, the premiers and the MECs will be important in steering the process of assessment of the effectiveness of hospitals to achieve good governance and efficient and effective service delivery to the people of South Africa. The Office of the Minister should submit an action plan on how the affected hospitals will address the issues that were raised during the inspections. I shall now hand over to the Public Protector Adv Mkhwebane to take you through her findings on a number of other investigations.
Thank you, DPP. Before I take you through my findings in the various matters, let me indicate that the following 5 matters have been closed on the basis that the allegations that gave rise to the investigations concerned were not borne out of fact and therefore unsubstantiated. I will merely list their long titles. The full reports will be available on our website later today. They are as follows: maladministration, irregular recruitment and procurement, as well as irregular increases in salaries by the South African Maritime Safety Authority, as alleged by Mr. Themba Ntshangase in a complaint lodged on the 5th of September 2017. The second one is undue delay by Armaments Corporation of South Africa, AMSCO, in the issuing of an outcome of an investigation conducted by Fair Bridges, Wortham Becker attorneys into alleged tender irregularities and failure by AMSCO to award a project package tender as alleged on 30 August 2019 by the complainant Ms. Lamini, who is the managing director of Deradia. Maladministration by the government officials who benefited from the government funding by leasing state-owned farms and used their relatives for fronting and as beneficiaries of these farms, as alleged by Mr. Sipho Maseko. Another closing report relates to allegations of violation of Executive Members' Ethics Code by the KwaZulu-Natal MEC for Health, Ms. Melanie Zulu. Another closing report relates to allegations of maladministration and improper conduct by the Culture, Arts, Tourism, Hospitality and Sports Sector Education and Training Authority, which is CATSETA, and the Department of Higher Education and Training in the matter which was lodged by South African Roadies Association. Allegations concerning the following 9 reports or matters have been substantiated and appropriate remedial action have been taken in respect of each. These matters cover themes such as pensions of government employees, housing, irregular appointments of staff, and procurement. I list the below long titles of the first 6 and deal with the last 3 reports. Copies of the full reports will also be accessible from our website later today. Report number 8 of 2020-2021 is an investigation into the allegations of improper conduct and maladministration relating to the appointment of acting municipal manager by the Kai Harip local municipality in Northern Cape, which complaint was lodged in 2018. The second one is report number 10 of 2020-2021 on an investigation into allegation of maladministration, nepotism, irregular expenditure, and the irregular appointment of Ms. Lali Chauke to the position of Human Resources Officer by the South African Council of Educators. Report number 12, 2020-2021. It's an investigation into allegations of improper conduct and maladministration by the Walter Sisulu local municipality in the Eastern Cape relating to the failure of to transmit pension fund contributions deducted from employees' salaries to the South African Local Authority Pension Fund. The report number 4 relates to report number 13 of 2020-2021. It's an investigation into allegation of maladministration, improper or suspected improper conduct in the appointment of Mr. Davenda to the position of Chief of Emergency by the Tshwane Metropolitan Municipality. Report number 5 relates to report number 94 of 2019-20. This is an old report on the investigation into allegations of improper conduct and maladministration relating to the appointment of Mr. Kongo as the driver messenger by the John Taule Gaetsewe District Municipality in the Northern Cape in 2017. The next report number 117 of 2020-2021 on an investigation into allegations of improper conduct and maladministration by the Buffalo City Metropolitan Municipality relating to the provision of title deeds to beneficiaries of the RDP houses in King Williamstown. So the next report I'll be detailed in reading our findings. It's the Basson versus the Department of Human Settlements, Water and Sanitation, which is report number 14 of 2020-2021. We've investigated maladministration by the Department of Human Settlement, Water and Sanitation, formerly known as the Department of Water and Sanitation, which is DWS, in awarding various contracts. And a complaint was lodged by Mr. Basson of the DA Deputy Shadow Minister of Water and Sanitation on the 18th of August 2016. So this is one of the old backlog matters. He alleged that the previous Minister of Water and Sanitation, Ms. Mukonyane, was involved in irregularities in awarding the following tenders at the DWS: repairing water infrastructure in the Mopani District Municipality, a project for which The budget escalated from 96 million to 506 million in 3 months. The raising of the Hazelmere Dam wall, a project which was approved in 2011 with a budget of 91 million and the projected to cost 359 million. At the end of this report with no end date, the building of Glen William Dam wall and the 36-kilometer pipeline between Craigieburn and Greyton. In essence, the complaint was that these projects had fallen victim to tender manipulation and political interference. After a thorough analysis of the complaint, I decided to investigate the following 5 issues: whether Lepelle Northern Water Board irregularly awarded the contract for the provision of water and sanitation services in the Mopani Giyane project to LTE Consulting without following a procurement legal prescript. The second issue, we investigated whether there was maladministration in the DWS Nandoni Ntsami Giyane bulk pipeline project. The third issue, whether former Minister Nomvula Mokonyane was involved in the irregularities in raising of the Hazelmere Dam wall, and if so, whether such involvement constitute improper conduct. And the next issue, we investigated whether the former Minister Mokonyane was involved in irregularities in the raising of the Glen William Dam, and if so, whether such involvement constitute improper conduct. And the next issue was whether Minister Mokonyane was involved in irregularities in the building of the 36-kilometer pipeline between Craigieburn and Greyton, and if so, whether the involvement constitutes improper conduct. Before dealing with the findings, let me provide a bit of context to help the public to understand how we arrived at the conclusion of this report. A copy of the appointment letter dated 24 August 2014 from the Lepelle Northern Water Board to LTE was perused. The estimated period of the work to be completed between 4 years, 13 months and 2 weeks. The estimated amounts were that Giyane Waterworks will cost 52,150,000 and the Giyane Water Waste Work will cost 38,800,000. But on the 25th of August 2014, Ms. Mokonyane forwarded a letter to the Lepelle Water Board, which inter alia issued a directive to Lepelle in terms of Section 41(1) Roman figure 2 of the Water Services Act 108 of 1997 to intervene with effect from the 18th of August on the Giyane water and waste water treatment in order to restore water supply to the residents. And on the 27th of August 2014, the Lepelle Water Board wrote to National Treasury and informed them that the Lepelle Northern Water Board was appointed as an implementing agent by the Department of DWS. As such, Lepelle Water had appointed LTE on a deviation due to the emergency nature of the project. Therefore, Lepelle was issued South Zambezi with an appointment letter for engineering and project management services for the following amount. So for the Giyane Waterworks, they issued for the estimated project management services fee was 1,100,000, and for the engineering services fee was 2,475,000. Whereas at the Giyane Water Waste, it was the project management services was around 807,500, and then for engineering fees was 1,842,000. And same day, Lepelle issued CAR2 Civils with an appointment letter for the construction service for the following amount. For the Giyane Waterworks, it was 45 million, excluding VAT, and for the Giyane Waste Waterworks was 33,500,000, excluding VAT. And same day, LTE issued LTE Civil and Structural P2I Ltd with an appointment letter for engineering and procurement, in fact for project management services for the following amount: for the Giyani Waterworks, 2,475 million, 2,475,000, and then for the Giyani Waterworks, it was relating to still the 807,500, which I've mentioned up there. So at the end of the day, the Lepelle North Water Board issued a letter. In fact, there was a letter which was issued to LTE, which we've perused, where they were appointing LTE for an estimated amount of 2,211,000 for a period of 5 years. A contract for emergency water and wastewater intervention in Mopani District Municipality on a turnkey basis was signed between Lepelle Water Board and LTE. It was October 2014, which Lepelle was represented by Mr. Lukhodi, whereas LTE was represented by Mr. Majola. So the cost price, as I've indicated above, 2,211,425,000. A copy of the invoice dated 13 October 2014 from Katu Civils also was perused, and they've invoiced for an amount of 170 million. This invoice was signed by Mr. Lukhodi on 14 October 2014. It was noted that this amount was paid 1 month after the contract was awarded. A copy of the program implementation plan also was assessed, where Mopani District Municipality Water and Sanitation Revitalization Program was perused. This was compiled by Lepelle North Water for Lepelle by LTE. It was noted that LTE was appointed as on an engineering, procurement and construction basis for the project. So there are different amounts which we are picking up from the documentation. Then there's also an addendum to the service level agreement, which increased the contract now from 2,211,000,000 to 2,808,000,000. And we could also see that Mr. Lukhodi also wrote to National Treasury and informed them about the appointment of Lepelle as the implementing agent for this particular project, and that Lepelle has appointed LTE for this project on a turnkey basis. But again, there was another letter which Mr. Lukhodi wrote to LTE, where they then informed LTE that the total cost for this Giyani intervention project will be, including approved variations, was now 2.9 billion. So on the 18th of July 2019, we then interviewed, in fact we wrote a letter to Mr. Chivase, the chairperson of the board of Lepelle, in response to the inquiry which the investigators wrote to him, and that in 2009 a drought caused water levels in the Ntsami Dam to drop to the extent that there was insufficient water to ensure a supply of water to the population of Giyani. So a local state of disaster was declared in terms of the Disaster Management Act of 2002, and the emergency measures had to be implemented to restore water services. So the Department of Water and Sanitation then appointed Mopani District Municipality as the implementing agent to implement and manage the project, and Mopani District appointed a certain contractors to implement the project. However, these contractors were challenged by unsuccessful bidders, the High Court alleging that Mopani District appointed these contractors irregularly. Now, the Supreme Court of Appeal declared the contracts void ab initio and set them aside in August 2014. And when that happened, on the 12th of August 2014, Ms. Mkhwebane held a government imbizo with the community of Giyani, of Mopani in the Giyani area. The primary aim as well of the Imbizo was to assess the scale and enormity of the crisis and progress in relation to measures that had been taken by government to address the water problem. So this has happened in 2019 already, and a disaster was declared in 2019. So by then in 2014, when Ms. Mokonyane was directing the Imbizo, in fact after the Imbizo, directed Lepelle Water Board that they need to be appointed as implementing agents, because the Supreme Court of Appeal has then declared the other appointment, which was the Mopane district as the implementing agent and those service providers, that was set aside. Now there was this process of appointing Lepelle as the new implementing agent, and that was done in terms of Section 41 of the Water Services Act. Pursuant to this, they then, Lepelle Water Services appointed LTE on a 10-key basis. A 10-key solution or project means a type of project that is constructed so that it can be sold or handed over to the owner as a complete project. So that's what happened. Mr. Chivas further stated that at the time of the project, Lepelle did not have a panel of service providers when it was appointed by Department of Water and Sanitation as an implementing agent. So then Lepelle decided to use the Department of Water and Sanitation panel of services to service providers, and that's where they found LT Consulting, which was confirmed as a category 6 of the panel of professional service providers. A copy of the Auditor General South Africa's engineers report dated 29 July 2017 was also perused by the investigators, and it was clear that, according to the report, LTE was charging rates that were above the Department of Public Service and Administration and that of the Department of Public Works. For example, AGSA report stated that the top rate for a consultant working at the level of a director was 1,300 per hour according to the DPSA scales, and the top rate for a registered professional principal was 1,448, which is according to the DPW, which is Public Works scales. So LTE was charging up to 3,500 per hour. Due to the fact that this project was never placed on tender, LTE was allowed to charge any rate that they desired. This was not value for money, fair, equitable, and cost effective. So according to the Auditor General's report, it was noted as well that CAR2 Civils was charging higher rates compared to other companies doing similar work. Once again, this was allowed to occur because LTE got the project without following the proper procurement processes. This in essence allowed the subcontractors to charge higher rates. This was not value for money as well, as we've indicated up. So we also received a letter from Godfrey Madubanya, the Legal and Compliance Officer from Construction Industry Development Board, which is CIDB, where he advised my office that LTE was not registered with the CIBD. Furthermore, he stated that in terms of Section 18 of the CIDB Act, all contractors have to be registered with the CIDB prior to rendering construction services to state public entities. So we then compiled a Section 7(9) notice. We also sent to the DG of Water and Sanitation, Mr. Trevor Blazer, who then disputed this allegation that indeed LTE was not registered with the Construction Industry Development Board because LTE was not a construction company, but it was a consulting company which was appointed on a 10-key basis, and also alleged that the public protector's preliminary findings were not substantiated. Further, that LWNW did not have a desired relationship with CAR2 Civils because CAR2 Civils was appointed by LTE, which LTE also relied on CAR2 Civils, and CAR2 Civils had these desired registration documents. And again, that the construction company, which is Katu Civils, they've done their work, and there was nothing which was found that Katu Civils have done shoddy work. So accordingly, it is submitted that the conclusions which were made by the public protector in the report on the appointment of LT was irregular, irrational, and not substantiated by evidence. So that's what the Department of the DG of Public Water Affairs was saying. So the conclusion to that effect, again, that the appointment of LTE was improper and constitute maladministration, irregular, fruitless, and wasteful with respect is not corroborated by any evidence. So that's what Water Affairs is saying. And also Water Affairs was saying the SIU has instituted legal proceedings as indicated above, challenging the appointment of LTE. Therefore, they propose in the circumstances that PP should keep this investigation in abeyance, again further delaying the provision of water to the people of Guyana. So, which is a challenge, and again the interventions by the courts, that's where then it also impacts on service delivery. So in June 2020, we received a response to our Section 79 from Mr. Lekhodi, from the CEO of Lipele, who submitted his response and stating that the minister signed the directive approving the recommendations outlined in a submission by the then acting DG of the Water Affairs, expressly stipulating that additional costs be submitted on completion of the business plan. According to Mr. Lekhodi, the directive expressly provided that it was saying, I therefore direct you to proceed with the implementation of the directive with immediate effect whilst the internal administrative procedures are being fast-tracked. You are also directed to establish a multi-stakeholder implementation steering committee to oversee the technical progress of the progress and submit.
And so we come out of that public protector briefing where she's giving feedback on some of her investigations